we're going to, and then I kind of put my Adson Brown by my small needle holder that's gonna be my skin stitch, right? And then I have my 2 longer needle holders for that. I do need somebody to be my circulator. Okay, so you'll have that board there when we're ready. And then we're not gonna go through the timeout right now, but we'll do the timeout, okay? So, so we're gonna come up here. I'm gonna say, okay, can I get a marking pen? This is right in my eyes. Can I get a marking pen? And you're gonna say, we need to do a timeout. So we'll do the timeout, right? So now you know I'm gonna need the marking pen right after the timeout, correct? So you're gonna take off the lid, hand the marking pen. Okay, so now I'm gonna make the mark, and then right after I do that, I'm gonna put some local in, okay? So while I'm doing this, you can bring your local up, okay? And then I'm gonna toss this back, and you're not gonna do anything with it until after you've handed the local, okay? So this is how we're gonna hand the local. You need to read it, okay? And then you need to hand it just like the knife, like this, okay? So when you hand it, you can take your hand up and off. If you have your hand under like this, and they do this, that needle's going into your hand, okay? So make sure your hand's on top, like this. So what I do, if I want to hand it with my right hand, is I take this off with my left hand, but I'll do this and I'll say 0.25% marking with Epi 1 to 200,000, take off the lid and hand it. Okay?
And you're handing it to them like this? Like you're placing it in their hand like a...
They're just going to take it from me.
Okay.
Yeah, they're going to just take it and put it in their hand however they want. I'm just going to hold it out like this. Okay? So I'm going to give it to them like this, and then I'm going to... then you're gonna set your cap where you can recap safely, you know, and I'm gonna put in the local. And then right after I put in local, I need a knife. I need to cut, right? So you can have the knife ready, you can pick it up and have it ready, right? I'm gonna throw this back and say needle back, and then you're gonna hand me the knife. 10 blade, okay? If you have it like this, you can pick it right up and hand it, right? So you're gonna hand me the blade. While I'm cutting, you're gonna take the syringe with the needle, recap your needle, and leave your syringe in this area. Don't put it way down here, okay? Keep all the sharps together, so keep it over here. And then I would recap this when you can too, and put it back somewhere, all right? So now I'm making the incision, and then I'm gonna just either set it down here, set it up here, I'm gonna say knife back, okay? So I'll put it up here, say knife back. The next thing I need is a bovie. So before I put the knife, I'm gonna grab the bovie. I'm gonna, one hand with the cord, one hand with the bovie, and hand the bovie. I don't need any forceps at this time. Somebody else might want a forceps. If they do, give them one of these, Adsons. Okay, we're right on the surface. We haven't gotten even down anywhere into the incision, right? So, so you're gonna hand me the bovie. Then you're gonna pick up the knife and you're gonna put it back there.
That's your dirty end.
That is the skin knife. I don't wanna use it again, okay? So when you set it down, that blade should be up against here. So if you set it here, it goes here. If you set it here, it goes here, okay? Doesn't matter where you set it. But they're gonna have to see it when you count, so you can think of that, I don't know. So anyway, I'm gonna just put it away from there. If you have room here, you can just set it right here, like this. Okay, doesn't matter. So anywhere in there. So so you're gonna put the knife back. I'm using the bovie. When I'm done with it, I'm just gonna drop it right here. So as soon as you see it, you're gonna drop it into the holster. All right. Now I need retractors. I'm gonna say rakes. You're gonna pick up the rakes just like this, and you're gonna hand me the rakes like this, so you can take your hands off and back. Never like this. They will rake your fingers with those, okay? On top, hand the rakes, right? So the rakes are gonna go in. The first assist is gonna stand here and hold them, right? Now we're just, so first assist will be right here. You're gonna be right here. Doctor's gonna be there, okay? So, so they're holding that, and then I need the bovie back again. But this time I need a forceps with it. So you're gonna give me the bovie and a DeBakey, okay? Hand the DeBakey. So hold down here, put it in their hand, right? So so now they're bovieing down, and then I'm gonna hit a vessel. I'm gonna hit a vessel that needs to be clamped because my bovie's not working. So I'm gonna ask for a clamp. You're gonna pick up the cryals, hand me one, hand me another one. 1, 2, okay? So right after the cryals, so that means I'm clamping a vessel. Now I need to cut the vessel. I need a Metz. So this is how you do it. You just grab the Metz right where you need to pick it up and hand it, okay? I'm gonna cut the vessel, and I'm gonna be throwing things up like this, all over your table, okay? You're gonna be open like this, everything. So you're gonna have to close it back up, put it where it needs to be, and keep it cleaned up, okay? Just as you go. So I'm gonna, as soon as I cut the vessel, now I need to tie the vessel. So we went over this, how to hand a tie, right? Okay, so you're gonna pull out the tie, you're gonna hold it like this, you're gonna give it to them in their hand like that. As soon as you hand that to them, they're gonna be tying, pick up your suture scissors, okay? Then they're gonna ask you to cut the suture, and you're gonna cut the suture. You're gonna drop it all over right here. You're just gonna pick it all up and put it into your garbage. Just dump it from here, don't stick your hand down in it, remember? Okay, and now they need another one. So another tie, cut the tie, pick up the garbage, throw it away. Okay, then now we're just dissecting some more, okay? So this would be back in here while we're tying too. So now I might go for some deeper retractors at this point. So probably Army Navies. So I'm gonna throw these back, and I'm gonna say, I need some Army Navies. So you're gonna grab the Army Navies. I don't care what side you give me, just give me the same size. Okay, just hand them. Okay, and then once you hand them, then you can pick things up and get things situated back on your table. So now that I'm a little deeper, I need some Mayo scissors, okay, curved Mayo scissors, and pickups with teeth. So go ahead and hand the curved Mayo scissors, pickups with teeth, and I'm starting to get down through the muscle and the fascia. So if I ask for deeper retractors, that's your cue. You better start getting things changed over. This is where we're gonna change everything over. We're gonna get rid of these Raytech and put the laps up, okay? So if I ask for clamps, I'm on the peritoneum, so you better get going quickly, okay? If I'm still going dissecting with the Mayo scissors and you have some time and you're not doing something, just go ahead and start it, okay? So what you're gonna do is you're gonna grab these and kind of scoot them out from in there. You're gonna toss them into that red bucket. You're gonna bring up your whole emesis basin with your laps and your pool suction. You're gonna take off the anchor and put on the pool. And then I'm gonna take these and I'm gonna kind of get them up there somehow, get them under the retractors. I have retractors up there. And if you can't get your hands up there, it's okay. Just toss them over, or just have somebody else do it. Okay.
And you said this is when they ask for the Army Navies.
I'd probably have these in right here.
That's when you would want to switch out.
Yeah, it doesn't matter though. I could totally be seeing with these and not switch. It's what I'm using for the instruments that should tell you what where I'm at. So if I'm gonna use the Mayo scissors and the pickups with teeth to get down there deep, and then I'm gonna clamp the peritoneum as soon as I see the peritoneum and tent it up. That is when as soon as I get under that peritoneum, there shouldn't be any Raytech up here. Okay, those are gone. So that's kind of your clue so I would start doing it when I've got the Mayo scissors and the big pickups, because you know, if you have time, just start doing it. So you're gonna get these up here. You're gonna leave this here and make sure that it's steady and that it's not like tipping or anything. Just lay it on their legs, it's fine. So we're just gonna leave it down there, and we gotta make sure that the suction tubing and the Bovie cord, nothing goes into that when the dirty stuff is in there. Okay, right now it doesn't matter, there's nothing in it, it's all clean. So I'm still going down with these, and then when I'm done with that, I'm gonna ask for 2 clamps. You're gonna give me 2 clamps, and I'm gonna grab the peritoneum, I'm gonna tent it up, and then I want a Metz. You're gonna give me a Metz, and I'm gonna nick it and spread it, okay? And then open it up and get these retractors down under the peritoneum. These could be anywhere, they're all over the place, so just pick it up, keep it nice and neat, okay? And then, so now I'm down under the peritoneum, okay? Now I just need to find the appendix, and we can get it out. So we're in this, I'm gonna see it like right away. Oh yeah, see, there it is right there. So here's the appendix. I'm gonna say, oh, there's the appendix. I need a Babcock. You're gonna hand me a Babcock, and then you're gonna hand me another Babcock, right? So when I'm in here, I clamp this Babcock. I'm gonna bring it out here so I can show you what I'm doing. Clamp it, another one, clamp it. Then I'm gonna ask for a curved cryal. So you're gonna hand me a curved cryal, and I'm gonna clamp that vessel. And another curved cryal. I'm gonna clamp the stump. And now I'm gonna cut this vessel and tie it. So I'm gonna say Metz, you're gonna give me a Metz. I'm gonna cut the vessel, tie, and I'm gonna tie it off. As soon as you hand me the tie, you pick up the suture scissors. If you can't get in there to cut, give it to the first assist, they'll cut. And then I'm gonna cut that off, and then I can take this clamp off the vessel. Okay, now, this is all down in this little tiny hole. I need the straight clamp. So I'm gonna clamp off the stump before I cut it off to close it, okay? So I'm gonna ask for the straight clamp. You're gonna hand me a straight clamp, and I'm gonna put it on the stump, clamp it down. Now I need the 15 blade to release this thing off of here. Okay, so I'm gonna say 15. You're gonna grab the 15 blade. You're gonna hand it. I'm gonna go down, nick it off, pull this all out, and I'm gonna put it all in the basin. Okay, so it all went in there, except for the straight clamp. It's still on there. Now I need to sew this up right now. Get it sewed up so I can get this clamp off here. So I'm gonna ask for a stitch, and the stitch I need is the 3/0 Polysorb, the 3/0 Vicryl, okay? These are in order right here on this thing right here. So it's 3/0, 2/0, 3/0. The first 3 O's right there. So if it's in the foam like this, remember that you have to hold the outside of the thing to steady it to get this out. Don't put your fingers in here. You will get marked down, okay? Then I'm just gonna get it right. I'm gonna control everything right here, okay? I'm gonna hand the 3/0, toss this back here like this, and then debaki. Okay, I want to debaki. It's gentle. I don't want to hurt anything. So I'm gonna come in here, and then just remember, you're gonna have a first assist here, so you're gonna have to know where your hand can be. If you got a little short first assist, don't put your arm in their face. You're gonna contaminate your sleeve, okay? So you're gonna have to go down and around, or whatever you have to do, and make sure that this suture doesn't ever go into that basin or down off of the side. So this is why I don't want you to pick this up and do this, because it's gonna go shh. Always have a hold of the end, okay? And bring it, toss it, hand it. And then I'm gonna start sewing. I'm really fast at this one. And I'm gonna pull, and now I need it cut. So you're gonna have your suture scissors, because you just handed me a suture, right? You're gonna have them in your hand, and then you're gonna cut the suture. I'm gonna take this whole suture. I'm gonna say my forceps are good. Some might put the forceps in there too. So I don't know what Miss A does. Then I'm gonna take this whole suture, and I'm gonna put it into that basin. I'm gonna take off the straight clamp, put it into the basin. I'm done with that. I need irrigation. Right now I'm gonna clean it all out. So I'm gonna say irrigation. You're gonna grab down here and put the bulb into my hand, okay? And as you hand it, you're just gonna say 0.9% saline, okay? So then I'm gonna put this in, and then once you hand me that, take this and put this in my other hand. Okay, just wait. They'll pick it up by themselves usually, but just do it. Do it for me right now, just to get used to handing things, okay? So you're gonna give this to me, this. So I'm gonna put this in here. Whoever's standing right here, the first assist, needs to make the suction noises. Okay? So this is going in, you're going, and if it's not loud enough or it's not working, then you're gonna get hit by this until it works. Okay? So that's always the law in here. First assist is the suction. Okay, and then when I'm done with this, I'm just gonna drop it down. You need to get it out of there, because it's leaking all over. You're gonna make a mess. Water comes out of this still. So you're gonna pick it up, put it back. But as soon as you hand that to me, you can take that basin away, okay? And when you take the basin away, you go down under the bottom of it like this. Do not stick your fingers in it. You will get marked down. Just like this, you're gonna take it and you're gonna set it at the very end of your table, all right? So then, now I've got everything washed out, rinsed out. Now I'm gonna ask for the next stitch. That is when you start your count, call for your count. The second stitch, doesn't matter what it is. Could be a 3/0, could be a 2/0, I don't care. But it's never the first stitch, that's the purse string. Okay, that's not a layer. Now I'm closing a layer. I'm gonna go straight to the fascia. I just want the 2/0. Okay, so I don't have a second 3/0, so I just want the 2/0. So I'm gonna say, I'm ready for my stitch. You're gonna get your other long needle holder, take out the 2/0, the big one, right? Get it on here right, control it, take it over. You're gonna hand the 2/0, hand the pickups with teeth. Okay, I'm going through big fascia, and I'm gonna start sewing. Then you're gonna say, I'm ready for a count, and the circulator Take that board out of there. Come over here. And so as soon as I drop these in here, if your circulator, go over, pick them up, shake them open, and hang them over the edge. So go ahead and do that with that. And you would have, of course, exam gloves on, right?
Right.
So, but stay away from the table. And whoever is in this spot testing, you are going to be responsible for if your circulator gets too close to your table. Don't let them hang over your table or get too close with their clipboard. Ask them to step back a little bit, okay? Okay, go ahead and open them all the way up. And like this, yeah, don't put your board on the table, like that, and then just hang them over the edge like that. So they have to be so we can see each one of them, okay? Yep, just like that, good. All right, so I'm ready for a count. And so what I would do, because they're sewing, so I have my suture scissors in my hand, and I just keep them in my hand like this. Okay, so I can work like this, kind of like I do with the clamps, the towel clips. I'm gonna have them in my hand like this, and then while I'm working, if they ask to cut, then I can just come and cut and put them back in my hand like this. My doctor hated that. He always told me, put those down, they're in the way, get rid of those. I'm like, why? I don't have to go searching for them. He hated it, I don't know why. But I'll just keep them in my hand, okay? So I'm ready for a count. And you're gonna say Raytech.
Oh, right there?
Okay, first thing I'm gonna do, so just step back just a little bit because you're kind of encroaching a little bit. Okay, good. So 12 inches, she was 12 inches, but I can see if she goes like this with her board, she might be a little too close. That's why I'm asking. Okay, first thing I do, patient. I check the patient. Just remember, patient first, okay? Anything on the patient, if it's on the patient, we count it first, okay? I'm gonna scan, I know I took my Raytex off, but I'm gonna scan it anyway. Raytex, no. Mail stand, Raytex, no. Okay, here's all my Raytex. I'm gonna pick them up. Okay, Raytex, 1, 2, 3, 4, 5, 6, 7, 8, and then you're gonna say 9, 10, okay? So she's gonna count those because they're off the field, and I'm gonna just follow with her counting that, okay? So she's gonna say 9, 10, and I'm gonna follow, yes, 9, 10, I see them, okay?
Laps?
Laps. There's 2 on the field, right? So I need to make sure I see both of them. If they are in a pile together, you need to physically pick them up and shake them out and make sure there's only 2 there, okay? If you can see them like this, that's fine. You can say, I have 2 on the field, 1, 2, okay? Everybody's gotta see it. And then I'll pick up the rest, 3, 4, 5. Keep them in 2 separate piles in case you have to redo it. You don't have to do all 10 of them again, right? 1, 2, 3, 4, 5.
Okay. Suture?
Suture, I have 1 working, it's on the field. I have 1 working, 2, see that? Okay, so the other one's in here. So I'm gonna make it easier on myself. I'm gonna just pick up this basin, keep my water here, put this empty basin here. I'm gonna take all of this stuff from here, dump it in, and I'm gonna take the emesis basin and turn it upside down right there on my table. So, like I told you, some people might not like this. I'm doing it because I don't want you to stick your hand in this at all anymore. It's dirty, it's yucky. But we're gonna set it like this, and you are not gonna go back to that. You're not gonna move it, you're not gonna do anything in that area right there. We are almost done, okay? Just don't go to it. But now everything's all in here, all nice, and we can see everything. So you would come around here, and you're gonna, look in here, but don't get too close. And I'm gonna say, do you see the suture? 3, okay?
Katie?
Necklace, I have 1, see that, 2, and 3. Now I can point in here, but don't put it all the way down in there, okay? Just point.
Hypo?
Hypos, I have 1, 2.
Okay. Bobby?
Bovie tip, you gotta come over here and take it out. 1.
Penrose?
Oh, no, we don't do those because they're at 0. Okay, so now you're gonna go right to the instruments.
Okay. Stringer? Boston Mosquito Curve?
Mosquito curved. 1, 2, 3, 4, 5, 6.
Mosquito Straight?
Mosquito straight. 1, 2, 3, 4.
Coral Curve?
Cryo curved. 1, okay. 2, 3.
Cryo
Do you see
Straight?
this way?
Oh.
4,
Okay.
okay.
Cryo Straight?
Cryo straight. 1 and 2.
Okay. Mayo Clamp?
Mayo clamp. 1, 2.
Alright. Alice?
Alice 1, 2.
Babcock?
Babcock 1, 2.
Coker.
Coker, 1, 2.
Needle drivers.
Needle drivers, I have 1 working, okay, 2 and 3 over there.
Sponge forceps.
Sponge forceps, 1, 2.
Tonsil clamps.
Tonsil, 1, 2.
Metzenbaum scissors.
Metzenbaums, 1.
Okay. Scissors. Mayo scissors straight.
Mayo scissors straight, 1.
Mayo scissors curved.
Mayo scissors curved, 1.
Alright. Perforating towel clips.
The towel clips are under the drape, we'll count them at the end. Okay.
Alright. And non-perforating towel clips.
Non-perforating towel clips, there's 1 here, and can you see the other one up there?
Yeah.
Okay, so you're gonna have somebody standing here. Okay, so if they're in the way, you can say, ask them if they can see it. If they can't, you can ask them to move back so they can see it. Okay, so they'll just kind of move back while they're holding their retractors. Okay.
Alright. Bottom of the tray. Richardson retractor.
I have Richardson retractors on the field, 1, 2.
Okay. Rake retractors.
Rakes, 1, 2.
Alright. Army Navy.
Army Navy, 1, 2.
Pool suction tip.
Pool suction tip, 1.
Okay. And
Could be
roll.
2,
Oh.
depending on how your place counts it. Okay.
Knife handle number 3.
Knife handle number 3, I have 1, 2.
Okay. Adson tissue forceps petite.
Adds in tissue forceps teeth, 1, 2.
Alright. Forceps smooth.
How about pickups with teeth?
Oh. Tissue forceps.
Tissue forceps with teeth, 1.
Yeah.
Tissue
And-
forceps smooth,
Yes.
1.
And the Bakey forceps.
DeBakey's, 1, 2.
And sun retractors.
Sins, 1, 2.
And the incidentals.
Just read them off.
Oh, okay. Number 7 knife handle.
Number 7 knife handles in here, 1.
And Adson Brown.
Adson Brown's, 1.
And Ferris Smith.
Ferris Smith's working, 1.
Okay.
Okay, so when you're done with that, so that's all. So I would say, doctor, the count is correct, except for the towel clips. We're going to count those at the end. Okay? So it's all correct. Everything's done, except we can't count those towel clips yet. Now, if you cannot see something in here and you need to move it around, you can grab something that you're not using, and I would prefer the sponge forceps because it's long and it's good. And you can take it and you can move things around in here until you can see it and say, oh, there it is right there. Now, though, this can't come back out. If I touched anything in here, I need to leave it in here. So you can just leave it like that and you can use it again if you want. If it falls all the way in, oh well, can't use it again, okay? Leave it in there. But don't take it back out and set it on your table. You've contaminated your whole table if you do that. Okay, this is dirty stuff. So you can just leave it in just like that, okay? So now, so they've been sewing this 2-0. They're gonna be done with the 2-0. Take all this stuff out, throw it up here. So I will always say needle back when I put it up on the mail stand, so you know that it's there. So you're gonna grab the needle and you're gonna secure it somewhere in here, right? Gotta be in there. And then I'm ready for my skin stitch, okay? So I'm gonna get the small needle holder, right? Put the 3/0 nylon on it. I sewed a little bit with it so it's short. Adson Browns, right? So I'm gonna pass the skin stitch, the Adson Browns, and then now I can give the suture scissors to the first assist because they're not holding a retractor now, they can cut. And I'm off the hook there. So I give them the suture scissor, and as soon as you hand off that skin stitch, you're gonna say, I'm ready for my next count, okay? It might be boom, boom. You might finish the count and go right into the next count because they've already finished and you've already during your count, you may have handed them the skin stitch already. Sometimes they're faster than what you can count all this stuff, okay? So I hand them the skin stitch. I said, I'm ready for my last count. The last count is just the soft stuff again. We don't have to do instruments again. Only one time with instruments, twice with the soft count. So you're gonna say, and say this one fell on the floor at the time, okay? It could, definitely. Things fall. They get caught under here, you're missing all of a sudden, you know, when you go to count them again. So you're gonna start with Raytech again.
Okay. Raytech.
Raytech, I'm gonna do a scan. Nope, okay. So I'm gonna grab my, where are they? Oh, here they are. Raytech. 1, 2, 3, 4, 5, 6, 7, 8,
9, 10.
9, 10.
Alright, that's
Yeah. Okay, laps, I have 2 on the field. Let's see, I have 1. Does anybody see that lap? That's what I would say. Somebody's got, oh, here it is on the floor. Okay, so we throw it in there. Okay. Don't count it. It's It's off the field now. So resist that urge, because this is what you do. You're so used to counting 2 up here that you will count 1, 2, and then go on with this. Don't do it. Say, oh, okay. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Okay? That's what you do. Okay.
So you don't say the last one, she does?
She does.
Okay.
And then you follow it. Yeah.
Okay, gotcha.
So anything that's off the field, the circulator is responsible for counting, and we just make sure. Anything on the field, we're responsible for counting, and they're making sure.
Gotcha.
Does that make sense? Okay. So now you're gonna go on to what? Sutures? Sutures. I have 1 working, okay, 2, and 3.
Knife blade.
Knife blades. 1, 2, 3.
Okay. Hypo.
Hypo. 1, 2.
And Bobby tip.
Bobby tip. They're closing skin, right? They're closing skin. Probably done with the Bobby. So I'm gonna ask, are you done with this? Yeah, I'm done with that. Okay, I'm gonna take it off. Bobby tip 1. And I'm gonna put it in my sharps container. That saves me one more step from when I'm cleaning up to not forget my Bobby tip. Now, if they still need it, then I gotta leave it there, okay? And some doctors get a little, they'll say that they're done, you take it off, and then they'll ask for it. So if they ask for it, you just gotta get it back out and put it on, okay? But if there's like sharps in there, don't get it out with your fingers. Grab it with something else, okay? Take it out and then hold it and then put it on. But that's gonna save me when I'm cleaning up to not forget about it, okay? Is that it?
Yes.
Okay, doctor, the count is correct, except for the towel clips that are under the drapes. We're gonna count those at the end. So you're saying that twice, okay? It's part of the count. And you're done. That's the whole checkup.